So hello everyone and welcome to Access Social Care's webinar, From Promise to Practice. Social care is the support that we receive in our own home, in a care home or in the community to live as independently as possible. Good social care enriches lives and supports well-being. It helps us to live safely in a place we call home, with the people and things that we love, doing the things that matter to us. Social care can enable disabled people and carers to remain in work. It can enable students to continue studying, and it can enable older people to live their last few years in dignity. We will all need social care at some point, either for ourselves or for a loved one. Access Social Care is a tech-enabled legal rights organisation that exists to make sure we all get the social care we need and have a right to. Every year since our inception, we have produced a report based on advice sector data looking at the state of the nation through the lens of social care. This year, we are taking the opportunity to consider what our data on adult social care tells us about the first year of the new Labour government. Now, you might have noticed we're recording this session. If you don't want to be recorded, I would invite you to turn off your camera. We'll be talking, I'll be running through some slides, and I think Cal has invited you to introduce yourselves in the chat. My name is Carrie Gerstheimer. I am the Chief Executive at Access Social Care, and I would like to take this opportunity to welcome our speakers. We've got Hannah Hewish, a legal manager and insight lead at Access Social Care. We've got Amit Kohli, our head of data, and we've got Andy McCabe, a convener at Social Care Future. Andy is a qualified social worker as well as a person who draws on social care. Andy was seconded into Access Social Care to share his expertise with us and to learn about how we use the law to secure rights. He is ideally placed to speak with authority about the findings of our State of the Nation report. So this is our agenda for the webinar today. Hannah will introduce the report findings for us. I will then bring in Amit and Andy for a broader discussion. I want to tell you a little bit about our campaign for government transparency, which we see as the other side of the coin to our data work. And then there'll be some time for questions at the end. I can't promise that we'll get to all of your questions, but we will do our best. So if you pop questions in the chat, if you've got questions for the panel, we will do our best to answer them. And we'll come back to those that we don't get to by email after the event. So these are our advice sector partners. They all contribute their data to help us to develop our report because they believe in our mission of combining data to gain powerful data insights. So to set the scene, in July 2024, a new Labour government was elected on a platform of change. Now, 1 year into this new administration, we are taking a closer look at how that change is unfolding. Our State of the Nation report considers Labour's first year in office, as I said, through the lens of adult social care. Has the promised change begun to take shape? Are people seeing real improvements in accessing the care they need? I'm going to hand over to Hannah now to look at what the data is telling us.
Thanks, Carrie, and welcome everybody who's joined this morning. So for the next couple of slides, I will touch on some of the key insights from this year's report, beginning with the subject of safeguarding, which you can see here on the screen. So I think it's fair to say that Labour has inherited a pressured and very fragile safeguarding landscape shaped by years of austerity, overstretched services and growing public need. And what we're seeing here, of course, reflects the impact of some of those years of austerity. But after 1 year in government, this should also be a moment of accountability moving forward. Safeguarding is about protecting people, both children and adults, from abuse, neglect and harm. Safeguarding is not simply just a service responsibility. It is, of course, a legal duty, a statutory duty on every local authority, but it's also more widely a cornerstone of a compassionate and functioning society and care and support system, reflecting how we care for those most at risk. And this year, as you can see, we've seen a dramatic rise in safeguarding related advice compared with the previous year before Labour came into office, and a 28% increase when we compare the past year's figures with 2019 to 2020. So I think it goes without saying that is a deeply concerning increase, and it tells us that more people are struggling and more people are at risk. The nature of safeguarding concerns is changing too, and many helplines now report that a growing number of cases relate to self-harm and suicidal thoughts, whereas certainly 5-10 years ago, we may have seen more instances of abuse perpetrated by another person. We're seeing many more instances of self-harm and suicidal thoughts. And this is definitely something that I've seen play out in my own casework as well. We know from our findings that older people are particularly affected by this increase. The cut to the winter fuel payment has left many unable to afford heating or food, triggering safeguarding concerns relating to their well-being. This is not about individual isolated cases of hardship and indicates wider systemic failure to support people who need it the most. We are seeing some reports of organisational abuse, increasing reports of concern around local authorities not responding adequately or in some cases at all to concerns raised with them about individuals with care and support needs. So is this good or bad news for Labour? It's a deeply concerning warning sign, highlighting an urgent need to properly fund already overstretched social care systems. And increased funding would allow services to look beyond what they are currently having to do in operating in essentially crisis mode, unable to prevent harm before it occurs. So this is Labour's opportunity to deliver a joined up preventative approach over the next year of their government, one that addresses the root causes in sufficiency of funding available to local government. And whether this becomes a turning point or a missed opportunity depends entirely on government's willingness to prioritise and fund sufficiently social care and to be transparent about how they are doing that, which Carrie will come on to talk about shortly. So moving on to the next of 4 themes we are whizzing through at lightning speed. The next theme is legal issues and complaints. So our report identifies helpline contacts, which identify a need for specialist legal advice or legal advice relating to a judicial review or perhaps a formal complaint. So 16.6% increase in Labour's first year of government in the amount of queries that are being identified as being so complex that they require that advice, and a staggering 270% increase since 2019. Many people desperately need legal support to understand their rights, but access to community care legal aid is very limited, and it's often financially not viable for law firms to provide that type of advice. And we know from Law Society research that 71% of the population lack a local community care legal aid provider, leaving many unable to get the legal help that they need at the very moment when they need it the most. So the rise in legal issues and complaints, of course, reflects growing pressure on an overstretched social care system. And if we look to local government and social care ombudsman decisions, we see that 80% of adult social care complaints in 2023 to 2024 have been upheld. So an 80% uphold rate on complaints raised through the ombudsman. That figure was 74% the year before, so an increase. And of course, we're all aware that many complaints don't make it through to the Ombudsman stage, or once they get there, face lengthy delays, well over a year sometimes once they arrive. So a clear imbalance of power, one which we knew existed before Labour's first year of government, but nevertheless has not shown signs of decreasing this year. And people with care and support needs face very challenging, lengthy and complex bureaucratic process without this important legal support to challenge the very failings that matter most to them. So again, a warning sign in their first year. Moving on to unpaid carers. Unpaid carers are family members and friends who provide crucial support to loved ones without pay, and they are the backbone of our social care system. This year, we've seen a 7.3% increase in advice seeking from unpaid carers, and that's more than double the level since 2019. A growing crisis in carer wellbeing, some of our helpline members reporting safeguarding concerns relating to unpaid carers themselves due to the level of burnout that they have reached by this point. Carers UK have done some amazing work looking in great detail, which we highlight in our report, at the alarming inequalities that unpaid carers are facing. Increasingly over the past year, they are more likely to have long-term health issues, they face higher poverty rates and see fewer opportunities in work and education. Over half feel overwhelmed, often due to lack of respite or support. Many don't appreciate that they are themselves entitled to a carer's assessment, distinct from a needs assessment for their loved one, which I'll come on and talk about in a minute. And for some people, they are aware that they can access a carer's assessment, but they face significant barriers and sometimes delays of several years in trying to secure that assessment and secure appropriate care and support. So another troubling picture in their first year of office. And whilst I've already said they have inherited a broken system, the continued rise in unpaid carer burden, lack of access to support for those unpaid carers, and persistent workforce challenges, which we will touch on a little bit today, suggests to us that promises of reform have not yet translated into tangible improvements across the sector. Finally, then, before we take a look back over the past 6 years and what that looks like, our final theme relates to assessments, needs assessments for people with care and support needs, and care plans are designed to deliver that report. Looking at our data for this year, we see a small reduction, 0.5%, in assessment-related queries, which on the surface could suggest that improvements are underway. The overall number of people waiting for assessments is still over 400,000. And though that equates to an 11% reduction in waiting times compared to the year before, this is still a substantial number of people left without necessary care and support. And so I think we must remain cautious. So many of the 400,000 still on a waiting list will later be assessed as having eligible needs. And importantly, our partner organisations as part of this project report increasing issues with gatekeeping at local authority level. So some individuals are not being directed to assessment processes adequately, much as with unpaid carers, and instead are in some cases told to rely on voluntary services or informal family or friends support. So again, a disconnect, a significant disconnect between policy promises and practice. Looking at care plans, there's a 14% reduction in queries about care planning, which again, at first glance, might seem like a sign of progress, but could also be tied into concepts of gatekeeping or individuals not fully understanding their right to a care plan or the significance of the care plan document itself, so key legal documents. And we don't have time to talk about it today, but our report delves into the concept of information and advice provision and the fact that helplines are seeing significant increases around that. That is a specific local authority legal duty to deliver that information and advice, and we are seeing that in many areas that's not happening as it should. And the reduction in queries should also be seen in the context of a kind of broader consideration. Fewer people may be coming forward for support, and those who are struggling to navigate the system. So again, welcome figures, but we should remain cautious. Any positive shift in query numbers we would expect would be corroborated by upcoming government data on waiting lists. So how that 400,000 will look like in the next publication will be very interesting. So the last couple of minutes before I hand back to Carrie, I will, that's brilliant, thanks Carrie. I'll look back, we don't have time to explore theme by theme what the past year of the Labour government looks like compared with the year of 2019-20 when our project first began. But what we can see on the next slide is that over the last 6 years, of course, we all know the social care landscape in England has become increasingly strained. And what does that look like for our helpline partners? It looks like a 99.5% increase in the amount of advice provision that they are delivering. And I think an important point to raise here is that helplines over the course of the past 6 years have had to increase their staffing levels. They've had to put in increased wellbeing support for the staff on their helplines. They've had to scale up a lot of their helpline provision to meet demand that they simply weren't able to meet before. There may well be a higher number of people trying to seek advice, we don't know, but the amount that helplines are able to deliver is 99.5% more than in the year preceding the pandemic, and 2/3 of that advice provision relating to each theme in our project has increased in sheer volume, so a clear sign of mounting pressures. The complexity of the issues coming through to our helpline partners, and I know in my own casework, in the casework of the legal team here at Access, is also growing. So that tailored, informed advice is more essential than ever. We touched on some of that in the legal issues and complaints section. So data is painting a stark picture of the need for faster action, and that requires real investment in the infrastructure of the social care system itself, and very importantly, transparency about how decisions on funding are made. And Carrie will talk about that a bit more in a few minutes. So we've touched very briefly this morning so far on some of the findings from the project, and our report also moves on to consider the broader policy landscape, which some of the other panelists will touch on shortly. Just a quick slide here on the government record on social care, and as I say, we will pick up on some of this in our discussions, but it's clear that social care is being profoundly shaped and in some areas destabilised already by wider government decisions. And in this first year of the Labour government, in some areas, we've seen a real disconnect between social care policy delivery and manifesto pledges. Despite promises of long-term reform, short-term action seems to have fallen short, or where action has been taken, it doesn't appear to have gone far enough to allay the significant concerns already being raised by the social care sector. For example, the national insurance contributions and national minimum wage issues. These were introduced rapidly by way of new policy without adequate funding to ease the impact on the sector. We'll touch on some of that this morning. That's been so concerning as a policy move as to prompt a judicial review led by Care England. And at Access Social Care, our members have told us that they are doing their best to protect the hours of support that people receive, but they're having to make cuts elsewhere to essential services, for example, safeguarding teams and health and safety teams. So they are trying to deliver the support that they need to deliver with great difficulty. The establishment of the Independent Commission, led by Baroness Casey, offers a real opportunity to explore these critical issues, which we've only had time to touch on really briefly this morning. And we're keen for the Commission to have full access to central government data in their important forthcoming work. And Carrie will say a bit more about this before the end of the webinar. So I'll now hand back to Carrie for some questions.
Thank you. So we're going to move now to a wider discussion, and I'm going to bring in our panel members. So firstly, Amit, and I'll stop sharing in a moment, but Amit, as Head of Data at Access Social Care, you are responsible for pulling together the data from our advice sector partners and using AI to help us understand the wider context. Can you reflect a little on the data insights within the report?
Thank you, Carrie, and hello, everybody. I think what I would like to do is almost present the counterpoint of, ignore the evidence that Hannah has been presenting and pretend like none of this happened, and instead consider what would a system look like if indeed the system was collapsing the way that we have been saying it is. So you're going to see more providers, individual service providers collapsing. You're going to see more people being unsafe, so more safeguarding requests and more ombudsman work that's being maintained. And you're going to see more unpaid unpaid carers requesting support, and also some work in terms of getting them more provision. And we're seeing all of these things. So I think when you triangulate the data, you generate evidence that is not one organization's opinion, but it's a systemic analysis of what is going on. And you generate this information that is almost undeniable. So on the provider collapse, we're seeing the providers collapsing already. And when they do collapse, what's going to happen? They're going to continue to, the people that were being hosted are now going to effectively have to go somewhere else. So you're going to see the NHS start to have backups. You're going to see more requests for housing. Why? Because the organization that was supposed to be looking after these people, that is fit for purpose, that is trained to provide lawful services to this community, is no longer able to do so. So this is evidence that you're seeing in government data sets, in other actors in the voluntary sector. So there is independent evidence that is backing this up. In terms of people being unsafe, Hannah was mentioning the ombudsman information, also our helplines data. And the beauty of our helplines collaboration is the fact that we have multiple organizations with different mandates looking at this together. It kind of allows us to triangulate in a way that the ombudsman, through no fault of their own, is simply not able to do, because they are much more of a passive role in terms of receiving a certain amount of cases, and then they'll hit saturation, whereas we can scale, and having multiple organizations does allow us to sample from the population in a way that is, I think, quite unique and quite concerning, when you take into consideration the findings that Hannah was talking about. And the last thing that I want to say about this is, when we're talking about unpaid carers, it's almost one of those things that when all the people that are receiving care now have to, fall back on their family and their support, all of these unpaid carers are entitled to provisions under the CARE Act. So it's going to be expensive for the government. This is one of those things that it looks like cost savings, but it's not, because they're going to have to anyway pay for the unpaid carers that are not going to be able to work as much. So it's almost like a double tragedy in that it's not even a strategic thing that makes sense. So I think this is why, when we're talking about the data portal and the work that we were doing in terms of trying to collect all this information, triangulate the helpline system with what are national organizations saying, I think there's real power in trying to combine everything and saying, what does the actual system of social care look like? And I think that's what we've tried to do, and that's what the findings of this report are more or less saying. I'm going to stop there.
Thanks, Amit. So at Access Social Care, we're interested in the quantitative data, but we're also interested in the qualitative data that helps us interpret what the numbers are telling us. And with that in mind, I'd really like to bring you in, Andy. The report speaks about an uplift in safeguarding queries, and I'd like to ask, as a person who draws on social care and also as a convener of Social Care Future, you're often out and about speaking to other people who draw on social care. So I'm really curious to know how that statistic of a 45% increase in safeguarding queries on helplines, I'd like to know whether that resonates for you.
Hi. Thanks, Carrie, and hi, everyone. Yeah, I'm Andy McCabe, even though my name says AM there for some reason. So yeah, what I'll try and do is give you a bit of, I guess, my personal experience, direct experience, and like Carrie says, people I know through Social Care Future and other people in the disability community. And also, interestingly, I think I've been thinking and reflecting on many of the themes in the report, and actually they resonate with things and research I did at uni, 8, 9 years ago, which is a bit like, sad really to see that these continual inequalities are still kind of playing out in the way that they are. So I'll try and use that lens to look at them. So in particular, thinking about safeguarding, and I've kind of been also considering the nature of the safeguarding, which Hannah, I think, mentioned earlier, that it's kind of moved from safeguarding issues that might be perpetuated by others, but it's now looking to be more about self-harm or suicide or mental distress in that nature. And I think the report does link that again to cost of living crisis as being part of that. But the first thing I'd like to kind of raise really is that when we think about all this report in the holistic nature that it should be viewed, is that the societal pressures of people who draw on support aren't, they're not separate to the societal issues everyone has. So I did a little bit of research last night and saw that the Mental Health Foundation found that now one of, if not the biggest cause of anxiety in the UK is being unable to pay your bills. And the British Medical Association found that over 80% of people had said their mental health had been negatively impacted by the cost of living. So social care is often kind of segregated off and seen as slightly different to the rest of wider society. But all these people are having all these, same problems that society is bringing. But then again, with research that I did at uni, if you actually look at the situation people who draw on support are in, and disabled people and older people, they're actually often in situations where financial pressures are much greater because being disabled in Britain isn't a cheap thing to do, much as there are benefits that are again not available to everyone, but also in situations where it's actually harder to obtain work because work has lack of adjustments, long-term health conditions make that difficult to do. So to me, when you read it all together, thinking about all these societal pressures and financial pressures on disabled people and people who draw on support, that already shows that actually it's probably more likely that they are going to experience this mental distress. But then
that
adding
really
on to
resonates.
that,
Sorry if I can just come in
No,
there,
absolutely.
Andy, just to say that really resonates because we've been working intensively in Gloucestershire for some time now. And what we found through our work in the county was that particularly people on the higher level of PIP were having to choose between food, heating their home, and paying for care, and they were opting not to pay for social care. So, big shout out to Gloucestershire County Council, who, as a result of the data that we provided to them, actually changed their charging policy, enabling people on the higher rate of PIP to have £30 per week back in their pockets. It cost the local authority about £3 million, but it's made a massive difference. So there are positive changes that can be made. Sorry, and back to you, Andy.
No, absolutely, and I think thinking about those positive changes, I think when you look at all these things the report's kind of highlighted, I see that obviously as a concern, but at Social Care Future, what we would probably and do try and do is think about that's actually an opportunity for change as well. It highlights where we need to focus our energy to make positive change. So reports like this are really helpful for things like that. And yes, so like you say, charging is a really big one, which I'll touch on in a second, because so what I've said is like, the cost of living is really affecting people, disabled people and people who draw on support are not best placed to challenge those financial problems. But then when you add in things like needing social care support, when you look at the report here, you can see that, things like long delays to get an assessment, those difficulties, and, the difficulties even of getting an assessment, getting the adequate social care that you are legally entitled to is also another kind of like, challenge and pressure that adds to mental health difficulties, I'm sure. And that is definitely something I've heard from people that I talk to who, I mean, even me personally, I think there's a quote from me on one of the King's Funds documents where I say I genuinely try to avoid talking to my social worker because as soon as I feel like I'm talking to them, it feels like there's a pressure that they then will start, thinking about cutting my budget, which is a additional pressure that lots of other people don't necessarily experience because in a way, it's back to that power imbalance that I think Hannah mentioned earlier, that it feels like social workers and local authorities have so much power to, in effect, take and give away your life at, at their discretion in a way that's quite hard to challenge. And that, that pressure is kind of like a lack of control of your own life. And that's definitely something I've heard from other people who are getting inadequate care packages and support packages. And even though I've, suggested things like Access Social Care, who do loads of great work with, challenging these decisions, and I've used them and they've helped me personally massively. And I recommend them and the chatbot to everyone. There are still people who actually are still so fearful of that kind of instigating problems that they're just, I don't want to even challenge this because I might get less than I've already got, which is already not enough. And then when you think, sorry, Gary, go on.
No. Do finish, Andy.
I was just going to say the last bit was like you were mentioning with charging there, because I think charging is a multi kind of faceted issue, which is like, it costs a lot to be disabled and pay for your support, and DRE can be a challenge again. It's like all these things that add up, I think, that you can see why actually it ends up in this kind of like safeguarding issue of actual mental distress. It's really what, to me, it's symptomatic of this whole societal pressure, but also the social care pressure. But the multifaceted angle, I think, of kind of charging is not only is charging difficult because it can be 50 to 100 to 120 pounds per week if you're only on benefits as well. But like for me personally, at my previous local authority, when I moved house, they miscalculated the amount of money that I owed them, which was zero, but they thought it was about £8,000. And to resolve that took over a year of back and forwards. But it also started, the first I knew really that they thought I owed the money was, with kind of very threatening letters of kind of like, bailiffs and things like that. And I'm in a really, well-placed position. I've got a lot of family support, community support, and professional support, as well as Social Care Future. And I just imagine how many people are getting letters like that. You add in, I'm just trying to layer it like over and over that it's, cost of living crisis, benefits now people are worried about. There's the worries, the increased financial pressures. And then there's also kind of that challenge, that continual challenge with local authorities who are often providing inadequate, support. And then you've got all these financial problems that bring up with that. And so that's where I was going with that. Sorry, Carrie, I'll let you.
No, I was just going to come in, Andy, and just reflect really that a lot of the time there's a perception maybe that safeguarding arises or is perpetuated by somebody within the person who draws on social care's life, whether that's somebody posing as a friend or a family member or somebody from the social care providing organisation. But in the cases that we see at Access Social Care, usually the root cause of that safeguarding issue is a council failure, so a public body failure, usually relating to a failure of the care duties contained in the Care Act. So, what you've described there is, again, the issue around funding and that relating back to your experience of a local authority getting it wrong. So it is really worrying. I can see, Amit, you had your hand up. Did you want to come in?
Yeah, on the funding issue, and I think it's without taking anything away from Andy's experience, I just want to highlight the fact that local authorities are being pinched on both sides as well, to the degree that they are admitting openly, we will act unlawfully because there's literally nothing we can do. We are already going broke providing the social care that we are doing. So it just creates a really nefarious attitude, a really nefarious incentive where now I'm going to go to evaluate Andy. Andy's scared to talk to me, and I'm being pressured to cut care effectively, or to at least compare care and say, oh, well, at least they're not as worse off as some other people that I have spoken to. So probably, you know what I mean? It just creates this really nefarious attitude where it's through no fault of their own. The system is set up for failure, and that creates a really difficult place to try to heal from, I think.
We'll come back to some of that information around central government funding and council funding later. But Andy, can I bring you in again on the second question? So when you're out and about, what other themes are you seeing, and does that tally with other areas of the report?
Yeah, okay. So at Social Care Future, we've done over the last couple of years, we've done a project, or we're doing a project called Plumbing and Wiring, where we're really trying to pick apart the actual barriers that people have to accessing social care, and trying to think about ways to kind of transform that. And through talking to people who draw on support and others in that area, and people, you know, who work in that area as well, we came up with about 6 main issues that people keep highlighting. And it's interesting because I was looking at the report that Access Social Care has done, and that kind of our findings of what people say who draw on support, and you can kind of map them very clearly. So we've got 6 here, but I'll just focus on a couple because I think they're the most important, because we also talk about things like, you know, IT systems, which I think I mentioned in this report as well, and regulation. But the main kind of 3 or 4, I think, are assessment and care planning. Again, like I mentioned, that this is been a problem that's highlighted as, I think, number 1 to us, and it's definitely one that I hear from people who draw on support in terms of delays, in terms of the quality of the reports and the assessments that are being made. And like I can say that in my own case as well, you know, it's very difficult, a difficult, long process that doesn't make anything kind of less stressful. Which again, I think again, I would say all these points always link back to that safeguarding thing that's cropped up there as well. And I know that in the report, you know, I won't go into all the figures and stuff, but I know there's over 400,000 people waiting for reports and almost 80,000 waiting more than 6 months. And that doesn't surprise me from what I hear. You know, that seems to be a complete difficulty that people have. But then it also has those kind of knock-on effects that kind of Amit talked about, which is if these are all being delayed, you're kind of building up pressures on the system as well. Like for me, I'm more interested in kind of like the actual people who are actually having their well-being impacted, you know, who should be able to draw on support. But actually what's being done is kind of like a false economy as well, because if you're not actually assessing people and working with them to support them to live the life that they want to live, what you're doing is actually probably deteriorating their well-being so far that the only point that they reach out to you or they get an assessment is when it's actually at the worst it can be for that person, which is terrible for everyone. I think one of the quotes we had in some of the stuff that we did when we were talking to people is really reflected in here, because we talk about care plans not being up to date and reflecting required support in the State of the Nation report there. But actually, one of the quotes that stood out to me was, I'll paraphrase, but along the lines of, the care plan that was provided for me, I thought was about a different person. So when we're also having to, so you've got people waiting for assessments for so long, and then the assessment quality being so low is such a difficult thing, and a thing that's being highlighted. And then that links, I think, directly to things like direct payments and the quality of direct payments that people are getting. So things that have been highlighted to us is not being able to flexibly spend direct payments, and then there being rigid and restrictive rules. And that's something, you know, that's one of the things I hear from everyone, and it's something I've experienced as well, that some of the rules just don't seem to make sense as well, are really, you know, not helpful. And because of that, you're not able to do things that would enable you to live the life that you're really wanting to do, and have the freedom to do things like that. And I think one of the biggest things that I've heard personally and seen is about the, you know, in this report that we're looking at today, it talks about, you know, the Care Act provision for an assessment to be carer blind. But actually what I see many times is, if someone is living with someone, or they've got someone who might be able to provide some support, that is kind of, you know, almost forced upon people to accept that actually they shouldn't get any social care funding because they're living with someone who should be doing all this stuff. And again, that leads to, you know, that's going to lead to all sorts of difficulties for people, not least because if someone is coming to social care because they're struggling, it's probably not helpful to send them back into that exact situation without any support. And that's definitely one that gets brought up time and time again, that I see as well. And that obviously leads a lot of pressure. One of the other areas is commissioning, which is kind of, it feels a little bit distant from people drawing on support, but it isn't, because one of our main things that we've seen is that there is almost little to no co-production in terms of commissioning. And then that means, you know, for me, someone who draws on support and is a strong believer of code reduction, you can never get it right if you don't involve people who are actually drawing on support in decisions, particularly about funding and thinking long term. And I think that kind of then links to this report that we're looking at today, where we're thinking about care providers, that aren't being commissioned correctly and are failing because of that. And to me, that shows what we hear, which is people want much greater control in the choice of commissioning and support that's available. So that would be my kind of hopeful thought of how it could be improved, because I think it shows you the current system is not working. And if we actually think about more creative ways to do things and involve people who actually draw on it, we'd actually be able to potentially mean that we don't need to talk about commissioning in these ways that we're talking about in these reports. And then just I like I said there, I've got a little bit about finance here, because finance is again one of the biggest things that is also raised to us in terms of DRE, disability related expenditure, blanket policies, and these are all reflected in this report as well. And why it's so difficult for people who draw on support to actually get their expenditure recognised. And then also part of that, which is something that I hear all the time, is that I know legally under the Care Act, you're meant to have an assessment before they start talking about finances. But again, highlighted in this report is that actually, it's almost used as a deterrent to say, oh, that care is going to cost X amount. So people don't want to go further because they don't know what that will actually mean for them. And that's something I hear as well, because, when I'm supporting people to do things with social care, to get social care support who clearly, are eligible for it, they often say to me then, they've already spoken about charging and I don't think I can afford this. So, if that's the first thing that's happening, you can see that again means that people aren't going to access the support that they are legally entitled to and actually should be getting. And again, all these points I think go back to safeguarding in that sense that it is sadly not even surprising that the nature of safeguarding has turned in the way that it has to just signify mental distress.
So thank you, Andy. It's really great to hear all of those perspectives. I've got one eye on the clock and we've got about 3 minutes left. So if you don't mind, I'm going to ask you one more question, and if you don't mind answering it really quickly in about a minute. I'd just like to sort of highlight that often we think about an increase in calls into helplines as being a bad thing, but it doesn't always have to be a negative. I think that sometimes it means that it's a good thing because people have known where to turn for advice and known where to turn to find out about their rights. So I just wanted to ask you quickly to reflect a little bit on the importance of people getting the right advice at the right time.
Absolutely. I think that is important. And firstly, I'd say it's really helpful that reports like this come out, because it does give us a chance to examine in detail those kind of those safeguarding concerns as to what is the root cause of those. But I think the importance of getting the right advice at the right time is as much as it's important to get the right social care, getting it right at the right time. Because if we don't do it at the right time, we're thinking about things like people falling through the cracks, like some people might say. And I think that's the opposite of early action. So what might be called prevention is something we'd call early action, to make sure that there aren't delays for people getting support. And then it goes back to that point of, if you're only meeting people when they're, they've been in a situation that's been going on and on where people are really struggling, actually the difficulty then is much longer social care support. And it also is much more intense. And again, that's more costly. And for me, it isn't about cost, but cost does matter because we've got limited resources, as we know. And if we were just more efficient with that, we could do much more already in the current funding climate, as long as we were doing things more kind of proactively. But for me, the most important thing about, doing things, getting the right advice at the right time and doing things at the right time is that it protects people's well-being, and it does stop that deterioration in mental and physical health, and it allows people to live well and not just survive, and means hopefully that people aren't having to, ring up their local authority in severe mental distress because they're not getting the social care that enables them to live a life that's independent and with dignity.
Thank you, Andy. So Amit, again, I'm mindful of the time. Again, if you don't mind answering this final question, just within about a minute. So just in preparing the report and in wider aspects of your role, you started to uncover some concerns about the quality of the data being relied upon for central government decision making on adult social care. I wondered if you could please just tell us a little bit about that whilst I bring up the slides for the next section.
Sure. So in 1 minute, I'm just going to talk about harmonization. So the fact that there is no kind of agreed upon ontology for social care. So you'll have things like the social care survey and the British social attitude survey kind of mapping to different entities, or the finance report and ASCOF mapping to different entities as well. Makes it kind of difficult to get a good picture. I also want to talk about the case level data, about the fact that the SALT survey is no longer going to be disseminated. And while the central government is saying that they are disseminating information from their case level data, is going to obfuscate a lot of the SALT information in practice, if not in theory. And it's also expensive. The tech is hard and it's under approval. So I do feel that SALT in a very real way is going away. And I think that's kind of a major thing that no one's talking about really. And then the third thing, and I guess the catch-all theme that is, Hannah talked about it, Andy talked about it, it's this concept of unmet need, right? Because check this out, right? If I want to solve social care with data, I'm going to stop providing care to everybody. And the survey instruments that we have are going to say that there's no problems in social care, right? So as long as what I said is true, then what are we talking about? Where are the efforts to try to quantify this? Because if there's a gigantic rug that I can sweep any amount of cases under, what do you think is going to happen? That was more than 1 minute. I'm sorry. I'm going to leave it there.
Okay, that brings us really nicely onto the next section of this webinar. So I want to just talk to you briefly about government transparency. So Access Social Care, we've been campaigning for some time now for government transparency on social care funding. And we're running a series of freedom of information legal cases alongside a campaign. So we see our government transparency work and our data work as really two sides of the same coin. Our hypothesis is that if we can secure greater central government transparency around social care funding decisions, then civil society, all of you on this call, can better participate in improving central government decision-making on social care funding. Now, by gathering and sharing our data and insight, we really want to contribute towards improving government decision-making on social care on a national basis in the same way that we have been trying to improve local decision-making with some of our communities' work. Civil society is broadly aligned that social care is underfunded. The Health Foundation says that we need £8.4 billion per year to meet future demand, improve access to care and cover the full cost of care. The previous government asserted it was adequately funding social care, but refused to publish the maths. Now, with such a reality gap between those two positions, we think that transparency could not be more important. Starting in 2021, Access Social Care started issuing a series of freedom of information requests to Treasury, the Department of Health and Social Care, and the now Ministry of Housing and Communities, asking for information relating to social care funding decision-making during the last comprehensive spending review. Government has repeatedly refused to provide the information that we have requested. Now, our requests for information broadly fall into two groups. Firstly, relating to equality impact assessments, and secondly, relating to a sufficiency test for social care funding. So in 2021, we started asking government for the equalities impact assessment and other equalities information considered during the comprehensive spending review. Government refused that request, and we went to the Information Commissioner, who held, having seen the information, that it was in the public interest for that information to be disclosed. government appealed to the Information Tribunal, who again saw that information and again held in our favour and said it was in the public interest for the information to be disclosed. The new Labour administration has asked the government for leave to appeal that decision. We are waiting for the tribunal to decide whether permission will be given and whether or not government will be allowed to appeal to the upper tribunal. In the meantime, and this is really important, when the Labour government announced the latest spending review in June, they failed to publish an equalities impact assessment altogether. The second round of cases relate to how government determines sufficiency of funding for social care. Back in 2022, the then Equalities Minister, Kemi Badenoch, gave evidence to a parliamentary committee that government had satisfied itself that they were sufficiently funding adult social care. We thought this was terribly interesting. So we started a second round of freedom of information requests, asking for information relating to that sufficiency test. Again, government departments refused to provide the information requested. We asked the Information Commissioner to consider the decision, and he held in our favour. Again, saying, after having seen the information, saying that it was in the public interest for that information to be shared. The new administration have again appealed, and that case will be heard in the Information Tribunal later this year. And what we would say is, if government are so confident they are sufficiently funding adult social care, what have they got to hide? We're pursuing government transparency because we believe openness is a deterrent to horse trading decision-making on resource allocation. Transparency would enable civil society to engage constructively to improve decision-making. Gaps and errors in government evidence bases could be identified and corrected by sector experts, and importantly, there could be public debate on prioritisation, which feels really essential in the context of the Casey Commission, looking at how we set up a national care service. Throughout the course of our cases, government have made important disclosures, some of which I can talk about, such as the admission from central government that there has been underfunding of adult social care, the admission that central government funding is really important, meaning that councils cannot solve the social care funding problem alone by raising council tax, and the admission that there is an additional need for spend of around 17% to reduce health inequalities for Black, Asian and minority ethnic communities. From what we've seen so far in the disclosures, there is also an alarming lack of consideration of the impact of unmet social care need. When our data is showing a 45% increase in safeguarding inquiries in the past year at Access Social Care, we think that's simply not good enough. There are other disclosures that I can't share with you because they are not yet in the public domain. So our approach is to continue to publicly share what we can of our own data, the disclosures, and any evidence that we have. And we're continuing to share what we can with the Casey Commission. We've also asked the Casey Commission to ask government for the information that we have been refused, because we believe that the Commission can't discharge its role without it. Now, if you're interested in hearing more about our government transparency legal cases and our campaign, you can sign up to receive updates on our website on www.accesscharity.org.uk/campaign. And I think that my colleague Cal has put some information there in the chat. So the next stage then is Q&A, and I think we're going to move now. I'll stop sharing and go to the Q&A section and see what we've got in there, see if we've got questions for our panel. Forgive me, it's just taking a moment to open up here. So I've got a question here from Samantha Clark. The point on unmet need is really important, and we think at Learning Disability England, and Chris Hatton says here, 13 to 24,000 people are not getting the social care that we need. How can we all better understand what is happening and the impact? And I'm going to bring in you, Amit, on that question. I think, how can we all better understand what can we do? And maybe you would like to speak a little bit about Access Social Care's live data platform and the project that we've got going on.
Yeah, I think we had a seminar earlier this week about, is there too much data, is there too little data? And the truth of the matter, just very truthfully, is both. There's a lot of information. It's really complicated to try to see what it's all saying, but there's also huge pockets. We were talking about unmet need. There's a lot about the system that we have no idea. So we built this concept called a data portal, in which we're combining all of the resources that we have been talking about here, national, voluntary sector. We're combining everything, and we're trying to see what that does in terms of trying to at least understand at a local level, what is the priority, what is the data saying, provide evidence so that if you want to go and speak to your local authority, you have something that you can say, in our section of the woods, this is what we are seeing, and have an evidentiary backing for that. So I think that's a component. If that's all that's necessary, remains to be seen. But at least it is a first step towards empowering people to have the information they need to change local first.
Thank you. And Amit, there's a question in the chat about the data portal. I wonder if you want to share the link in the chat
Sure.
to respond to that question. I can see that there's another question from, where are we, Oliver Bruff. The government and a fair few civil society organisations have suggested AI tools can reduce backlogs in waiting for assessments and even improve the quality of assessments. Hannah, I think that you've got some quite strong views on this, so I'm going to bring you in for a comment on that.
Yeah, absolutely. I think it's a really interesting question, particularly as local authorities are increasingly relying on AI to, they're building it into case management systems, for example. And I think we don't understand enough about how that AI has been trained to fully understand the nuances of the challenges that are being faced by people who need care and support. So AI can be an incredibly useful tool, both in delivering care and support and in some elements of decision making. But it's really unclear, I think, as to how, and that's the $1 million question, how is that actually being implemented? Can local authorities deviate from a decision that AI makes? We know that local authority funding is stretched, and in part, obviously, AI is being used to address that. But I think it raises more questions than it answers, I think, for me, and probably more concerns. So certainly in my own casework, we've come across decisions that appear to have been made by funding panels who appear, and again, there's a real lack of transparency at local authority level sometimes in funding panel senses, appear to have been at least assisted by an element of AI decision making within a funding panel. And it's really, really, really hard to challenge the outcomes there. So I think it remains to be seen as to exactly how the use of that technology will play out. But there are significant concerns about the fairness of that technology.
I can see that we've got 2 minutes left. I can see there's a question here from Hugh Evans around how do we feel that safeguarding is increasing because of increased need for safeguarding, or do we think that local authorities are getting better at spotting safeguarding issues? Sorry if that question seems naive, but wondering if we have a way to tell. So just to be clear, Hugh, this is about safeguarding issues being raised on helplines, not safeguarding issues being raised with local authorities. My feeling is that this increase is probably because local authorities are not correctly directing people to safeguarding, or letting people know how to raise safeguarding issues, or indeed properly dealing with safeguarding issues when they are arising. That's certainly so. Hannah, when she prepares the data from the report, interviews the different helpline organisations to find out how to interpret that data, and that's certainly what that qualitative interview process is telling us. And I can see, Andy, you're nodding. I don't know if you wanted to just come in briefly.
Yeah, no, I think much like you say, it's clear, I suppose, that it's the helplines that are raising it. And I think personally, my point, from what I hear from people, I think it is just that culmination of societal stress that seems to be getting worse, and post-COVID as well. I think there's been there was a section of time that was very stressful, when I think a lot of those issues are kind of coming out now a bit more, that people are finding with their personal anxiety and their personal situations, from what I hear. And I think probably, like I say, with the safeguarding and the fact it's kind of specifically about, I think, mental distress, really is the mixture of the societal issues and the kind of difficulty people are having obtaining the services and support that they are entitled to.
Thank you, Andy. I can see we've reached the end of a time, and I can see people are starting to leave. So I wanted to say a huge thank you to everyone that's been involved in preparing the report. Thank you to our panel members, particularly to Andy. And thank you to everybody that's come to listen to hear about this report and the report's findings. If you're interested in working with us going forwards on our data work, or indeed if you want to find out more about our government transparency campaign, please drop us a line. You can contact us via our website, and we would love to hear from you. And if you want to contribute in this work going forwards, please